Hello students, today I will explain you the medulla oblongata. This is part 2 of the brainstem. In the part 1 I have explained you the midbrain and the pons, and in this lecture I will explain you the medulla oblongata. So this is the brainstem here. So this is the whole brainstem. Here is the midbrain, this is the pons, and here is the medulla oblongata. Today I will explain you the medulla oblongata. The specific objectives which I will try to cover is the first is describe the external features of the medulla oblongata, mention its relations as well as its blood supply, describe the internal structure of the medulla oblongata at various levels, particularly its principal nuclei and pathways including the pyramids, cranial nerve nuclei, gracile as well as the cunate nuclei, and the arcuate and ascending fibers. The medulla oblongata is also called by the name bulb. So whenever we explain some of the clinical conditions like bulbar paralysis, it means there is some abnormality within the medulla oblongata. So the other name for medulla oblongata is the bulb. So as you have seen the picture before, it is the lowermost part of the brainstem, this medulla oblongata, and we explain you in a separate lecture this medulla oblongata because it has very important as well as vital functional centers here like the breathing center, the heart rate, GIT and blood pressure. It also contains very important reflex centers like the vomiting, coughing, sneezing, hiccup, swallowing and digestion. So they are very important as well as vital functional controls are in this part of the brainstem. So here you can see this is the picture showing you the brainstem, and the lowermost part this is the medulla oblongata, and here you can see the cardiovascular center, the respiratory center and other centers. This medulla oblongata intervenes between the cranial end of the spinal cord just above the first cervical nerve below and caudal end of the pons above. So above there will be the pons and below it will continue as the spinal cord. The shape of this medulla oblongata is almost piriform shape or conical in shape, and the diameters are the length is 3 centimeters, breadth is 2 centimeters, and 1 centimeter in breadth, thickness. So it is 3 centimeters in length, 2 centimeters in breadth, and 1 centimeters in the thickness. And this medulla oblongata will be lying in the anterior part of the posterior cranial fossa in the infratentorial space. So this is the medulla oblongata which you can see from the front view. And if you take a section of this medulla oblongata, it will be close in the lower part with a central canal, and in the upper part it will be open. As you have seen, this is the posterior view of the medulla oblongata, and here you can see the fourth ventricle. Because of the presence of the fourth ventricle, if you take a section at the lower part, it will be a closed one, and if you take a section at the upper level, because of the presence of fourth ventricle, it will be open. There is also a very important junction called as pontomedullary junction, which is represented ventrally by a horizontal sulcus. So the junction between the pons and the medulla oblongata is by a horizontal sulcus, where we can see the rootlets as well as the nerves coming from the sixth, this is the seventh and eighth cranial nerves arising from this particular horizontal sulcus. And if you trace it dorsally, posteriorly, then you can see the stria medullaris crossing the fourth ventricle. So anteriorly we have the sulcus and posteriorly we have the stria medullaris. This indicates the part which is below this part will be the medulla oblongata. Relations: anteriorly there will be clivus and meninges, and posteriorly we can see the vallecula of the cerebellum. Vallecula is a part of the cerebellum. When you study cerebellum at that time, you will actually appreciate the presence of vallecula. Now coming to the external features of the medulla oblongata, it is incompletely divided into two equal halves. If you see this picture, so this is incompletely divided into two equal halves by an anterior median fissure. This is the anterior median fissure and the posterior median sulcus. If you have seen the posterior view here, this is called as the posterior median sulcus. This one is the posterior median sulcus. So we have the posterior median sulcus, and anteriorly there is anterior median fissure. So these two sulcus and the fissure will divide this whole of the medulla oblongata into two halves. These are the two halves. Each half is again subdivided into anterior, lateral, and posterior position. So again, this because of the importance of very important structure deep inside, we divide this brainstem into many smaller regions, so that in each region you can appreciate what are the structures which are present. So again, this each half, this is the right half, this is the left half, is divided again into anterior, lateral, as well as the posterior regions by the presence of anterolateral sulcus here, and behind there will be posterolateral sulcus. So apart from the anterior median fissure and the posterior median sulcus which are in the midline, there is also anterolateral sulcus as well as the posterolateral sulcus. So there is one fissure and three sulcuses. So what is the anterior region? Anterior region is this area between the anterior median fissure and the anterolateral sulcus. This region is called as the anterior region between the anterior median fissure and anterolateral sulcus. So this region is called as the anterior region. So this region is very important because of the very important structure present here. This is the longitudinal elevation given by very important motor pyramids, motor fibers which are running through this area, and they form a very important structure called as pyramid, which is made up of mainly of the cortico-spinal fibers which are running from the cortex, and they go all the way into the spinal cord and from to different parts of the body. Apart from that, there are also corticobulbar as well as few corticopontine fibers which are present in this pyramid. Mainly it will be made up of corticospinal fibers. And the arrangement of fibers is, if you see, upper limb will be on the medial side. Medial fibers will be mainly for the upper limb, and the lateral fibers will be mainly for the lower limb. This lower part of this corticospinal fiber cross the midline and they form something called as the pyramidal decussation. If you see here, so the fibers which are running here, most of the fibers, 70 to 95% of the fibers, they cross from one side to the other side. So they crisscross. Okay, so this crossing of the fibers from one side, from the right side to the left side, or from the left side to the right side, this is called as decussation. Because it is the decussation of the pyramidal fibers, it is called as the pyramidal decussation. In this picture, if you can appreciate, these are the corticospinal fibers. They are coming from the cortex, area number 4, 6, 3, 2, 1, and they pass through the internal capsule and they go in different parts of the brainstem, if you can appreciate. So these are the fibers of the corticospinal fibers in case of the midbrain, and in case of the pons we have already studied. In case of the pons, this is the region where we can see the corticospinal fibers, and in the medulla oblongata they are most anterior here, and these form the pyramid. And if you see below, they will descend and then they crisscross, they cross on the other side. So this is called as pyramidal decussation, because this is called as the pyramid. So this is the pyramidal decussation. These are also called as the motor decussation because these are the motor fibers. So and they go to the opposite side. If you can see here in the pyramidal decussation, if you take a section, this is how you can appreciate the decussation, and then they form the lateral corticospinal tract. Some of the fibers, they don't cross, around 10 to 20% they don't cross, and they go on the same side, and then they form the anterior corticospinal fibers, if you can appreciate. So this is the section taken in the the spinal cord, and here you can see the lateral corticospinal fibers, and here you can see the anterior corticospinal fibers. So lateral corticospinal fibers decussate fibers, so 70 to 90%, and around 10 to 20% or 30% will remain on the same side, and then they form the anterior corticospinal tract. Corticobulbar fibers connect with motor nuclei of the cranial nerves nuclei of the opposite side. So some of the fibers will be the corticobulbar fibers, which cross to the opposite side, and then they connect with the cranial nerve nuclei. So we will talk about the cranial nerve nuclei which are present in this region. The lower four will be the nerve nuclei which will be present in this medulla oblongata. So you will appreciate later in sections when we take. Corticopontine fibers synapse with arcuate nuclei, which are homologous with the pontine. We have seen the pontine nuclei here. So around this corticospinal fiber, there are a lot of pontine nuclei, and these pontine fibers, the pontine nuclei will be present in the pons, and there are some fibers which passes through along with the corticospinal fiber. These form the corticopontine fibers which end in this pontine nerve nuclei. And in the anteriormost part of the pyramid, there will be few fibers which will form the arcuate nuclei, as well as the nuclei which are present here. These form the arcuate nuclei. These are nothing but the pontine nuclei which will be present in the most anterior part of the medulla oblongata also, and they form the arcuate nuclei. Efferents from both ipsilateral nuclei and contralateral arcuate nuclei assemble at the anterior external arcuate fibers, and then they cross on the other side and go to the cerebellum. Okay, so the fibers which form the arcuate nuclei, they crisscross on the opposite side, and then they pass into the cerebellum. The abducent nerve is attached to the brainstem between the lower part of the pons and the cranial end of the pyramid. If you have appreciated, so the abducent nerve is the nerve which is just above the this pyramid. If you can see here will be the abducent nerve. If you have seen the previous picture, you can appreciate here. This is the abducent nerve. This is the pyramid here, and this is the pons. Between the pons and the pyramid, you can see the sixth cranial nerve fibers, that is the abducent nerve. So again, this is the picture showing you the corticospinal fibers starting from the cortex, passing to the internal capsule and in different parts of the brainstem. And here is the position of the pyramidal fibers crossing here. This is the pyramidal decussation. Some fibers don't cross and they go and they form the anterior corticospinal tract, and those which cross will go on the opposite side and they form the lateral corticospinal tract. Here this is the same picture which is showing you both the motor fibers as well as the sensory fibers, but mainly now you can see here the motor fiber crossing the medulla oblongata, and they pass into the opposite side of the spinal cord, and then they supply the depending on which side it is there, it will be supplying on the right side or the left side. So the fibers which are coming from the left side will be supplying on the right side, and the fibers which are coming from the right side will be crossing to the opposite side and they supply the left side. Now going to the second part of this brainstem, that is the lateral region. So lateral region is here between the anterolateral sulcus and the posterolateral sulcus. Between these two, there is a very important structure, oval elevation, called as olive. So this is the olive here, which is between the anterolateral sulcus and the posterolateral sulcus, and it is a very small structure, almost 1 to 1.5 centimeters. The average is 1.25 centimeters, and this is produced by underlying mass of gray matter, which is called as the inferior olivary nucleus. We will see the inferior olivary nucleus when we take a section at this level. So there is an important gray mass inside, deep inside, and that is called as the inferior olivary nucleus. So here you can appreciate the the presence of olivary nucleus, inferior olivary nucleus within the olive. This is the olive. So this is the anterolateral sulcus and this is the posterolateral sulcus, and this is the pyramidal decussation. This is the pyramid, and here beyond will be the pyramidal decussations. Just above the olive, we can appreciate the two roots of the facial nerve. So facial nerve is between the pons and the olive. The rootlets of the hypoglossal nerve also emerge, but on the lateral side from the anterolateral sulcus. Here you can see here. So this is the hypoglossal nerve, which is this is the hypoglossal nerve which is coming from the anterolateral. This is the anterolateral sulcus, and here is the posterolateral sulcus. The hypoglossal nerve, which is the 12th cranial nerve, comes through the anterolateral sulcus between the pyramid and the olive. The 9th, 10th and 11th cranial nerve emerge from the posterolateral sulcus. So here behind, this is the posterolateral sulcus behind, and here you can appreciate the 9th, 10th as well as the 11th cranial nerve which is coming out from this posterolateral sulcus, and here is the 8th cranial nerve. This is the vestibulocochlear nerve, which is the 8th cranial nerve. Now coming to the third region, this is called as the posterior region, which is between the posterolateral sulcus and the posterior median sulcus. If you can appreciate here, this is the posterior median sulcus, which is the midline, and here is the posterolateral sulcus. Between the posterolateral sulcus and the posterior median sulcus will be the posterior region. The upper part is marked by a V-shaped depression which is coming from the fourth ventricle. So this is the fourth ventricle here. So the upper part of this medulla oblongata is marked by V-shaped depression. This is from which form the floor of the fourth ventricle. And below this fourth ventricle, in the posterior region, you can appreciate three important longitudinal elevations. One is called as the fasciculus gracilis. If you can appreciate here, this is the fasciculus gracilis. This is the fasciculus cuneatus, and then we have the inferior cerebellar peduncle. So here is the inferior, which is connecting between the medulla oblongata and the cerebellum. The fibers either running into the cerebellum from the medulla oblongata, or they are coming from the cerebellum into the medulla oblongata. So this forms the inferior cerebellar peduncle. So three elevations can be seen. One is the fasciculus gracilis on either side, fasciculus cuneatus, then we have the inferior cerebellar peduncle. The upper end of these fasciculus gracilis and cuneatus will be expanded to form the gracile tubercle as well as the cuneate tubercle. If you appreciate here you can see here the gracile tubercle and the cuneate tubercle, and it is formed by the underlying mass of the gray matter of this nucleus. The nucleus of the gracilis and the cuneate is formed by the underlying gray mass, that is the nerve nuclei themselves will be present in these regions. So here will the first order neuron, then the end here, and the second order neuron begins here. So the nerve nuclei will be present in this gracile tubercle as well as the cuneate tubercle. So here fasciculus gracilis and cuneatus will be having fibers, and the tubercles will be having the cranial nerve nuclei. Not the cranial exactly, it will be the nerve nuclei which will be present there. The gracile tubercle of both sides are separated by V-shaped sheet of ependyma of the fourth ventricle. If you can see here, these are the two gracile tubercles, and in between they are separated by the presence of the V-shaped floor of the fourth ventricle. The lower medulla, in the lower medulla, another elevation, the tuberculum cinerum, will be present, which is lateral to the fasciculus cuneatus, produced by the nucleus as well as spinal tract of the trigeminal nerve. Here on the lateral side, you can appreciate the presence of something called as the tuberculus cinerum, which is formed by the trigeminal nerve nuclei as well as the spinal the tract of this trigeminal nerve. So you have appreciated already in the part 1 of the brainstem, where you have seen in the midbrain as well as in the pons also, the trigeminal nerve as well as its tract, because trigeminal nerve as well as its nuclei is very long, and uh, it is present in all the 3 parts of the brainstem, that is in the midbrain, the pons, as well as the medulla oblongata. And below it extends up to the second cervical segment of the spinal cord, and it continues as the substantia gelatinosa of the Ronaldo, and acts as the guide for the neurosurgeons during transection of the spinal tract in the treatment of the trigeminal nerve. In case of trigeminal nerve, it is a very important guide for the neurosurgeons to take the transactions. The inferior cerebellar peduncle, which is also called as the restiform body. This is the inferior cerebellar peduncle, which is also called as the restiform body, is present in the lateral part of the posterior region and diverge above to form the lateral boundary of the fourth ventricle. If you can see here, this is the floor of the fourth ventricle. On either side, you can appreciate the presence of the inferior cerebellar peduncle, and which will form the lateral boundary of the fourth ventricle. Medullary stria and vestibulocochlear nuclei are traced at the junction of the pons and the medulla oblongata. If you can see here on the dorsal side, in the posterior side, this medullary stria will divide and differentiate between the pons and the medulla oblongata. The part which is above will be the pons, the part which is below will be the medulla oblongata, along with the vestibulocochlear nuclei. The floor of the fourth ventricle will be having the medullary stria. You can see here, this is the medullary stria. Median sulcus, the median sulcus, the sulcus limitans will be there. Then we have the hypoglossal as well as trivagal nuclei. If you can see a trace here. So here is the vagal triangle, where we'll have the vagal trigon, also called a vagal trigon, and deep inside will be the vagal nerve nuclei. And here is the hypoglossal triangle, where deep inside will be the hypoglossal nucleus. And here you can appreciate the vestibular on the lateral side. We can also see the cochlear nuclei. And the inferior fovea as well as the lowermost part of this fourth ventricle, which is called as the calamus scriptorius, because it looks like a nib of a pen, of an ink pen used to be like this, with this fashion V-shaped lower part through which we can write. So this is called as calamus scriptorius, and this point at the lowermost point, it is called as the obex. Inferior to vagal triangle is a very important structure called as the area prostrema. Just on the inferior side to the vagal triangle is the vagal triangle on either side, and here there is a very important area called as the area prostrema, the neurons of which acts as the chemoreceptors for the vomiting reflex. So the vomiting reflex is deep inside here, which will be called as the area prostrema. The anterior median fissure. Now just we will discuss about the fissures in some detail. So this is the most anterior fissure. This is called the anterior median fissure. So here is the anterior median fissure. This is the pons, this is the midbrain pons, and the medulla oblongata. In the medulla oblongata, this is the anterior median fissure. It is a deep vertical cleft, ends above in the form of something called as the foramen cecum. Here above on the top, it ends at the foramen cecum. Similar, we also have a foramen cecum in the tongue. So here also we have a foramen cecum, where this anterior median fissure will end above. Below it will continue as the fissure of the anterior median fissure of the spinal cord. So it will run as the corresponding fissure of the spinal cord, anterior median fissure. Decussation of the pyramidal fibers make it shallow at the lower part of the medulla oblongata. You have already seen here. If you see, these are the two pyramids. In the lower part, this is the anterior median fissure, and on either side will be the pyramids. In the lower part, you can appreciate the decussation of the fibers from one side to the other side. So this fissure becomes shallow because of the decussation of the fibers. Coming to the anterolateral sulcus, which is on the side of the pyramid. So this is the anterolateral sulcus. Here you can appreciate the anterolateral sulcus. So it is between the anterior and lateral region. So this is the anterior region, this is the lateral region, in between will be the anterolateral sulcus. Here you can appreciate the anterior region, this is the lateral region, in between is the anterolateral sulcus, between the pyramid and the olive. And this groove will be, or the sulcus will give rise to the origin of the rootlets of the hypoglossal nerve. You can see here also. So this is the hypoglossal nerve, which is coming between the pyramid and the olive. In line with the attachment of the ventral rootlets of the spinal nerves. If you go below, this anterolateral sulcus will be giving rise to the ventral roots of the spinal nerves. Spinal nerves have dorsal root as well as the ventral root, the anterior and posterior root. The anterior roots will be coming in the same sulcus here, anterolateral sulcus. So above it will be for the rootlets of the hypoglossal nerve, and below it will be for the ventral roots of the spinal nerve. Now appreciating the posterolateral sulcus, which is on behind here. Okay, so it is between the lateral as well as the posterior. So the posterior is behind, where we can see the fasciculus gracilis and cuneatus, and here this is the lateral area. So in between the lateral, where we have the olive, and posteriorly we have the fasciculus gracilis and cuneatus, in between will be the posterolateral sulcus, and this will give rise to the attachment of rootlets of 9th, 10th as well as the 11th cranial nerve. And below, if you continue below into the spinal cord, then this is the area from where the dorsal roots of the spinal nerves will be coming out. Now going to the posterior median sulcus. This is a faint longitudinal groove, and it contains above with the median sulcus of the fourth ventricle. So this is the median sulcus of the fourth ventricle, and below it will continue as the corresponding sulcus of the spinal cord. So here will be the below, this will be continuing. So here will be the median sulcus of the floor of the fourth ventricle, and contains below as the posterior median sulcus of the spinal cord. Now studying the internal structure of this medulla oblongata. So whenever we study the midbrain and the pons, we take section at two levels, in the upper level as well as in case of the lower level. But in case of the medulla oblongata, because of presence of very important nerve nuclei as well as very important centers, so we take we study the medulla oblongata by taking section at three levels. One is through the lower part of the medulla oblongata, where we can see the pyramidal decussation. So here is the pyramidal decussation. So here we take a section at this level and study. Then we also take a section at the sensory decussation. Sensory decussation is at a higher level, and we take a section at that level, and which passes through the middle of the medulla oblongata and study them. And the third will be in the mid-olivary region. So this is the olive. In the center of the olive we take a section, and again at that level we study. Here this will be posteriorly, it is related to the floor of the fourth ventricle, so it will be open part of the medulla oblongata. So these two are the closed part, and this will be the open part. Now if you take a section at the lower part of the medulla oblongata at the pyramidal decussation, the first thing you appreciate is the pyramidal decussation. So this is the pyramid here on either side, and here you can see the pyramidal decussation. So it resembles to a large extent to the sections of the spinal cord, because it contains below as the spinal cord. So some of the important regions are very similar to that of the spinal cord, especially if you see the central canal. It will be the central canal, and around that the gray matter around the central canal, with ventral and dorsal gray columns, if you can appreciate. So here is the ventral gray column, which is separated from the central gray matter by the decussation of the pyramid. The pyramids are most anteriorly placed. If you just take a section, so you can appreciate, so wherever the pyramid is there, that is the most anterior region of this section. And as you can appreciate, the crossing of the fibers, as I said before, 70 to 90% of the fibers cross from this pyramid to the other side, and then they form the lateral corticospinal fibers. Some fibers, they don't cross and they remain on the same side, and then they form the anterior corticospinal tract. Here it will be almost here, somewhere here will be the anterior corticospinal tract. It can be much clearly appreciated in the spinal cord. So here you can see these are the two pyramids, and here are the fibers crossing from one side to the other side, and then they form the lateral corticospinal tract. So here again, this is the whole course of this corticospinal fibers, beginning from the cortex, and then they pass through different parts of the spinal the brainstem, and then in the lower part of the medulla oblongata, they cross to the other side and form the lateral corticospinal tract. So here also you can see this is the pyramid, and if you can appreciate the crossing of the fibers here, this form the lateral corticospinal tract, and they enter into the spinal cord. Some of the fibers, they don't cross, and then they form the anterior corticospinal tract. If you see, this is in the motor region, which will be in the anterior region. The posterior region is mainly sensory, and especially the posterior most part. You can appreciate the fasciculus gracilis as well as the cuneate, which occupy the most posterior part in the white column. And this fasciculus gracilis and the cuneatus, as I said, are sensory, and they will be carrying the touch, pressure, sense of vibration, position, as well as movement from the ipsilateral side. They will be on the same side. These are the sensory fibers. Now you can see here, these are the dorsal nerve rootlets, and here you can see the dorsal nerve nuclei. So these are the first order neuron. They are entering into the fasciculus gracilis and cuneatus, and they are running on the same side. So they are coming from the same side. They also cross, but a later stage. Now you can, in this section, you can see the fibers from the same side. So they are from the ipsilateral side, and they are mainly sensory fibers, which is having the touch, pressure, sense of vibration, position, as well as movement of coming from the same side. The fasciculus gracilis will be having fibers from the lower limb and the as well as the lower trunk of the body, and the fasciculus cuneatus will be having fibers from the upper part of the body as well as the upper limb. So you can imagine a person lying from the head on this side and the lower limbs on the other side towards the median sulcus. The decussating pyramidal fibers separate from the anterior horn and form the central canal. You have already seen this is the central canal as well as the central gray matter, and they is separated from the ventral gray column by the decussation of the fibers. The decussating pyramidal fibers separate from the anterior horn from the central gray matter, and this form the supraspinal nucleus, which will be forming the ventral neuron, give rise to first cervical nerve from this part. So the first cervical nerve and elongated lateral neuron extend up to C5 and give rise to the rootlets of the spinal part of the accessory nerve, and distally it is in line with the nucleus ambiguous. This ventral part will be giving rise to the cervical nerve, the first cervical as well as up to the fifth cervical nerve. The posterior gray column is continuous with the nucleus of the spinal tract of the trigeminal nerve. If you can appreciate, the posterior gray column will be separated from the central gray column, and here you can see the presence of the trigeminal nerve nuclei as well as the tract on the lateral side. So here in this region, the nucleus is much more larger and the tract is very small. In other regions, you can see the tract is thicker and the nucleus will be smaller. Okay, so especially in this region, the nucleus is large, spinal trigeminal nerve nucleus is large, and the tract is very thin on either side. You can see this is the tract. And this the nucleus of the trigeminal nerve extends from the pontomedullary junction to the C2 in line with the principal sensory nucleus of the trigeminal in the pons, and a bundle of fibers covering this nucleus form the spinal tract of the trigeminal nerve. You can see here the spinal tract of the trigeminal nerve, which is a bundle of fibers around the nucleus. If you take a section at the middle part of the medulla oblongata where there is crossing of the fibers of the sensory fiber, then this is called as the sensory decussation. This is the motor decussation. We have seen this is the motor decussation. So this is called as pyramidal decussation, or also called as the motor decussation. Now what we are studying is the sensory decussation. So here, if you can appreciate the nerve nuclei of the especially if you see this region, sensory region, here you can see then nucleus gracchalis as well as the cuneatus much more larger, and here you can see the fasciculus gracchalis and cuneatus very thin. In the previous region, we had seen this the fasciculus gracchalis as well as cuneatus, it is bigger, larger, and the nuclei are smaller. Okay, and the fibers are more, but here at this region they end, these fibers, if you can see here, they end at this this is the first order neuron, they end here in the nucleus gracchalis and cuneatus. So here in this region, especially if you take a section at this level, then you can see, appreciate that the nucleus are much more larger. So in this region, if you take section, the fasciculus gracchalis and cuneatus will be larger and the nucleus will be small. And if you take a section at this level, where the sensory decussation is taking place, then you can see that the nucleus are much more larger. Here is the nucleus gracchalis as well as the nucleus cuneatus, which is much more larger in this region, and the fasciculus gracchalis and cuneatus are very thin, smaller, because most of the fibers will end in this nuclei. See, so the gracchalis nucleus and cuneatus are much more larger and separated from the central gray matter, and they are separated from the central gray matter. The fasciculus gracchalis and fasciculus cuneatus end in this nuclei, so they end, so that's why the nucleus is much more larger. Now there will be beginning of the second order neurons. We can see here, so they cross here, they begin, this is the first order neuron, this is the fasciculus gracchalis and cuneatus, end in the nucleus gracchalis and nucleus, and then the second order order neurons will begin, they cross to the opposite side, this is called a sensory decussation, then they extend up to the thalamus, then in the thalamus they end, then there will be the beginning of the third order neuron, and then they go to the sensory center in the cerebral cortex. So there is first order neuron, second order neuron, third order neuron in case of the sensory fibers. So the crossing of the fibers is by the second order neurons. Okay, so there is the sensory decussation. So here you can appreciate the second order neurons. So now they are crossing, they are beginning from the nucleus gracchalis and cuneate nucleus, and they cross to the opposite side, and then they form the something called as the medial lemniscus here on the opposite side. So this is the crossing of the sensory fiber, also called as the sensory decussation. Just lateral to the cuneate nucleus, we can also appreciate something called as the accessory cuneate nucleus. This is the cuneate nucleus, and just near to that there will be something called as the accessory cuneate nucleus. What does it contain? It will be containing the proprioceptive fibers. What do you mean the proprioceptive sensation? It means the sensation of the position of the joint. Whenever you give a command, if the brain is giving a command to the joint, then you should know beforehand that what is the exact position of the joint, whether it is flexed or extended. Depending, if it is flexed, you cannot give again the command as flex the elbow joint or any joint. Okay, then the brain always know that this is the position of the joint. Now you can do only the opposite movement or something like that. So that sensation of the position of the joint is called as the proprioceptive. Okay, so the proprioceptive fibers, especially for the upper limb, will be present in this accessory cunate nucleus. The nucleus of the spinal tract as well as the trigeminal nerve nuclei as well as the tract can be appreciated here. Here you can see again here in this sensory decusation also you can see a larger spinal nerve nuclei, trigeminal nuclei, and this is the spinal tract of the trigeminal nerve. So this is again showing you the pyramidal fibers here. This is the pyramid, okay, and here is the arcuate nucleus, and here in this region, the sensory region, mainly because this is the section at the sensory decusation, so you should appreciate the fasciculus gracilis and fasciculus cunatus were thin, but the nucleus gracilis as well as the nucleus cunatus is larger because the first order neurons end here. Then there is beginning of the second order neuron, they cross to the opposite side, and then you can see they ascend upwards in the form of medial meniscus. Okay, here you can appreciate the presence of the accessory cunate nucleus, which is mainly responsible for the proprioceptive sensations, especially for the upper limb. And on the lateral side, you can appreciate the nucleus of the spinal tract of the trigeminal nerve, and here is the spinal tract of the trigeminal nerve. So this is the tract and this is the nucleus. The inferior olivary nucleus can be seen as a crumpled pus in the anterolateral side. If you can see here, this is the inferior olivary nucleus, but it is not very clear in the upper part. When you take a section, you can see the actual how it looks like a crumpled pus. Okay, so this is the inferior olivary nucleus on either side, the anterolateral side. The central gray matter contains the hypoglossal nucleus. Very important nucleus are there. This is the central gray matter, and this is the central central aqueduct, which is present here. And here on the either side, you can appreciate the presence of very important nerve nuclei. One is the hypoglossal nerve nucleus. So this is the hypoglossal nucleus. This is the dorsal motor nucleus of the vagus, and the most posterior will be the nucleus of the solitary tract. So the hypoglossal nucleus belongs to the somatic efferent column and supplies all the muscles of the tongue. So this is the hypoglossal nucleus supplies all the muscles of the tongue except the palatoglossus. When you study again the tongue, at that time you will appreciate the different muscles of the tongue, and one of them is called the palatoglossus, which is not supplied by the hypoglossal nerve. All other muscles are supplied by the hypoglossal nucleus, hypoglossal nerve. So, and the nucleus of this hypoglossal nerve will be present in this medulla oblongata around the central gray matter. Then we have the dorsal nerve nuclei of the vagus, belongs to the visceral efferent column and provides origin for the preganglionic parasympathetic fibers for the heart, for the smooth muscles, as well as the glands of the respiratory as well as the GIT. So all it will be supplying a lot of important organs like the heart, the lungs, as well as the GIT. So the nucleus of this vagus nerve will be present on the lateral side in the central gray matter of the medulla oblongata. Then the most posterior will be the nucleus of the solitary tract. So this is a very important nucleus, especially for the special visceral efferent, and they will be receiving fibers from the anterior cranial part of the facial, glossopharyngeal, as well as the vagus. So there will be the special sensation of taste fibers, which will be carried by the facial, glossopharyngeal, and the vagus from the oral cavity. So that center will be present here. This is called the nucleus of the solitary tract, mainly responsible for the taste sensation in the oral cavity. Fibers derived from the nucleus gracilis are ventral and the nucleus cunatus are dorsal. If you can see here, the fibers which are the second order neurons which are coming from the gracile nucleus will be on the ventral side. They go anteriorly. The fibers which are coming from the cunate nucleus will be going on the posterior side, that is the dorsal side. The nucleus gracchalis and cuneate give rise to internal arcuate fibers. So this crossing of the fibers and going to the opposite side lead to in the formation of something called as the internal arcuate fibers, which cross to the opposite side to form a paramedian band of fibers, which is called as the medial lemniscus. So here you can see here the medial lemniscus on the opposite side, with the head present on the posterior side, which is represent on the posterior side, and the feet will be on the anterior. So you can imagine a person lying with the head on the posterior side and the limbs on the anterior side. So this is how it is. Here it will be the head will be on the lateral side and the lower limbs will be in the medial side. But as the fibers cross, they also go on the opposite direction. So the lower limb will be here now and the head will be on the other side. In short, the nucleus gracchalis and cuneate receive afferent from the fasciculus gracchalis as well as the fasciculus cuneatus and provide efferents to the opposite VPL nuclei of the thalamus. So here these are the fibers which are coming, which are in the fasciculus gracchalis and cuneate nucleus, fasciculus cuneatus, and the end in the nucleus gracchalis and cuneate, and the second order begin from here, cross to the opposite side, end in the medial lemniscus. They don't end, they form medial lemniscus and they ascend upwards, and they end in the thalamus, especially in the VPL nucleus of the thalamus. So the medial longitudinal bundle is just behind. So you can also appreciate the medial longitudinal bundle, which is just behind here. Spinocerebellar as well as lateral spinothalamic tract are present on the lateral column. If you can appreciate the spinothalamic as well as the spinocerebellar tracts are on the opposite, on the lateral side, on each side of the internal inferior alveolar nucleus. So here is the inferior alveolar nucleus. On the lateral side we can see the other important tracts like the spinocerebellar as well as the spinothalamic. Ventral spinothalamic tract conveys the crude touch and pressure passing through the medial lemniscus. So the ventral spinothalamic tract, if you can appreciate here, these are the ventral spinothalamic tract, will be conveying crude touch as well as pressure, and they passes through the medial lemniscus. Now taking a section at the uppermost part of the medulla oblongata, which is also called as the open medulla or at the mid-olivary position. So this is the medulla oblongata, and here in the olive, in the mid-olivary position, if you take a section, then you can also appreciate that a part of the fourth ventricle comes here, so it will be open medulla. So when you take a section at that time, you can appreciate that this is how it looks like. In case of the closed, the central aqueduct will be in the here at the center, and the central gray column will be around. But in case of the open type, so it will be totally open on the posterior side. There is no central aqueduct here. Okay, so this forms the floor of the fourth ventricle. The nuclei of the cranial nerves from medial to lateral side in the fourth ventricle are present, and these are, one is very important, nerve nuclei are present on the floor of the fourth ventricle. One is called as the hypoglossal nucleus. So here you can see here that the hypoglossal nucleus has come in this position. In case of the upper section, it is in the central gray column. So here the central gray matter and hypoglossal nucleus, but in case of the upper part, it has come to this position. It comes to the position of the floor of the fourth ventricle. So it is the most medial nucleus in the floor of the fourth ventricle. Okay, so this will be forming the hypoglossal triangle. Then we have the dorsal nucleus of the vagus just lateral to it. So here is the dorsal nerve nucleus, which is present on just lateral to. Then we can appreciate the presence of the nucleus of the solitary tract also present here. So you can appreciate. So here is the solitary tract as well as the nucleus. Then inferior and medial vestibular nuclei. You can appreciate the presence of vestibular nuclei on either side on the fourth ventricle. Okay, so we have the hypoglossal nucleus, then the nucleus of the vagus, dorsal nucleus of the vagus, then we have the solitary tract and the nucleus, and on the most lateral side we have the vestibular nuclei. Inferior cerebellar peduncle, which is also called as the restiform body, can be appreciated on the most lateral side. On either side, you can see the inferior cerebellar peduncle, which is also called as the restiform body. The nucleus ambiguous lies in the reticular formation. So here in the middle of all parts of the midbrain, pons, and medulla oblongata, you can see appreciate the presence of the reticular formation, and in the center of that we can see the nucleus ambiguous, and gives origin to the motor fibers of the 9th, 10th, and 11th cranial. This nucleus ambiguous is very important because it gives rise to the motor fibers for the 9th, 10th as well as the 11th cranial. This is called as the nucleus ambiguous on either side. Dorsal and ventral cochlear nuclei can also be seen. If you can see here, these are the ventral and this is the dorsal cochlear nuclei. So this cochlear nuclei with the vestibular nuclei will form the vestibulocochlear nucleus, vestibulocochlear nerve. The nucleus of the spinal tract of the trigeminal nerve, if you can see here, this is the nucleus of the trigeminal nerve, and this is the spinal nuclear tract of the trigeminal nerve. So this is the nucleus and this is the tract of the trigeminal nerve, which is present on the dorsolateral side. So here again you can see here, appreciate the presence of the pyramid in the front, and here on the floor of the fourth ventricle you can see the hypoglossal nucleus, then you see the dorsal nucleus of the vagus, then you see here this is the solitary tract as well as the nucleus, and here you can see the vestibular nucleus, and this is the inferior cerebellar peduncle, which is also called as the restiform body, and here you can see the nucleus ambiguous, which is the motor nucleus of the 9th, 10th, and 11th nerve, and here you can see this is the trigeminal nucleus and this is the trigeminal tract. So all these are some of the important structures which are present in the dorsal side. Apart from that, in the ventral side you can see the inferior olivary nucleus. As we said, this section is at the mid olivary position, so you can see the complete nucleus of the inferior olivary nucleus. So this inferior olivary nucleus will form a complex with some of the other structures like the inferior medial as well as the dorsal accessory nucleus. If you can see here, so this is the medial nucleus and here is the dorsal accessory olivary nucleus. So all this inferior olivary nucleus along with the medial as well as dorsal accessory olivary nucleus will form a complex. This is called as the inferior olivary nucleus complex. So the inferior olivary nucleus is the largest gray matter at this level. So this looks like a crumpled pulse. So this looks like a crumpled. If you take this is the actual section, and here you can appreciate the presence of the inferior olivary nucleus. So this is the section taken, and this forms the floor of the fourth ventricle. Okay. The arcuate nucleus lies most anteriorly, ventromedial to the pyramids. So this is the arcuate nucleus on either side. Here you can appreciate the arcuate nucleus on either side. This is the pyramid here, and represent nuclei pontes. So these are nothing but the nucleus pontes. Afferents for the arcuate nuclei is from the cortico-pontine fibers. So as I said, the afferents which are coming from the cortex, they end here in the pons, and they form the pontine nuclei, and efferents sweep the pyramid and olive as anterior external arcuate fibers, and then they go to the opposite side and enter the cerebellum through the inferior cerebellar peduncles. Some fibers proceed dorsally through the medulla to form the medial sulcus of the fourth ventricle and decussate and sweep lateral to the floor of the fourth ventricle, forming the medullary striae. You have already seen the medullary striae. These are nothing but the fibers which are coming from the arcuate nucleus, and then they reach the cerebrum through the inferior cerebellar peduncle. So the fibers which are coming for the arcuate nucleus are from the cerebral cortex and they end in the pons, and the efferent fibers from here from the pontine nuclei will go to cross to the opposite side, forming the external arcuate fiber, and then they go to the opposite side through the inferior cerebral peduncle to the cerebellum. So this is the inferior olivary nucleus and the fibers which are going to the opposite sides. And these are the fibers which are coming from here from the cerebral cortex end in this inferior alveolar nucleus. So these are called as the cortico-pontine fibers, and then they cross to the opposite side and go to the other side of the cerebellum. Okay. So these are all the connections which are shown for the inferior alveolar nucleus. And here you can appreciate the sensory fibers. These are the first order neurons, these are the second order neurons crossing to the opposite side, and these are the third order neurons. And these are the different positions of these fibers. In case of the lower part, you can see that they are forming the fasciculus gracilis and cunate nucleus. Then in this section, at this crossing of the fibers, you can see the nucleus gracilis, cunate nucleus, and the second order neuron forming, crossing to the opposite side, and they form the medial lemniscus. Now in the upper sections, you can appreciate how the medial lemniscus will change its position. This is in the medulla, and here in the pons, and this is in the midbrain. So how it has changed its position. Then the fibers end in the thalamus, and third order neuron goes to the somatosensory area, that is the sensory area of the cerebral cortex. The alveocerebellar tract fibers emerge from the hilum of the inferior alveolar nucleus. From the hilum, this is the hilum, and you can see here there will be some of the fibers which form the alveocerebellar tract, and pons to the opposite inferior cerebellar peduncle and through to the opposite cerebellum. So there are fibers which in the hilum of this inferior alveolar nucleus, which will be called as the alveocerebellar fibers or the tract, and then they cross to the opposite side and they supply the other side of the cerebellum. All ascending tracts from the spinal medulla lies in the anterolateral part of the medulla. All ascending fibers will be from the spinal medulla lies in the anterolateral part. Okay. Now coming to the blood supply of the medulla oblongata. The medulla oblongata is mainly again supplied by the two vertebral arteries. If you can appreciate, this is the medulla oblongata, this is the pons, and this is the midbrain. So here medulla oblongata is supplied by the two vertebral arteries. These are the two vertebral arteries from their branches. One is the two vertebral arteries will give rise to the anterior spinal arteries. They join in the midline to form the ventral spinal artery or the anterior spinal artery, which will be supplying the anterior and anterolateral part. If you can see here, this is the area supplied by the anterior spinal arteries. Then the posterior spinal artery, if you can see here on either side. So anterior or the ventral spinal artery is only one single in the midline, but the posterior or the dorsal spinal artery will be on either side. Okay, so here this is the dorsal or the posterior spinal artery. So here also you can appreciate. So they are on either side. Then we have the posterior inferior cerebellar artery, very important artery which is supplying cerebellum, also supply the upper part of the medulla oblongata, as well as some of the direct branches which are coming from the vertebral artery and other arteries. Okay, so the area supplied by the posterior spinal artery will be this area, and the area supplied by the posterior inferior cerebellar artery is this area on the lateral side, and these are from the direct branches of the vertebral artery. The venous drainage is into the superior as well as inferior petrosal sinus, occipital sinus, as well as the transverse sinus. The inferior medullary veins continue with the veins of the spinal cord. Okay, so this is about the blood supply of the medulla oblongata. As I said before, it is mainly by the vertebral arteries, branches from the vertebral arteries, the two anterior vertebral arteries joining to form the ventral spinal artery or the antispinal artery, which supply this area. The knowledge of this blood supply is very important, because later I will discuss with you the clinical importance. So the knowledge of these arteries supplying the areas, as well as what are the important structures deep inside, you should know, so that you can appreciate the damage caused by the if there is any block as well as atherosclerosis or thrombosis of these arteries. Coming to the applied aspect, there are conditions called as lateral as well as medial medullary syndromes. Lateral as well medial medullary syndrome, because it is in the medulla. So if there is any damage to the medulla, that is called as medullary syndrome. Okay, so there are two conditions called as lateral as well as medial medullary syndrome, caused due to thrombosis of the posterior inferior cerebral artery or the thrombosis of the antispinal artery respectively. So if there is blockage of this or the thrombosis of the posterior inferior cerebral artery, that is called a lateral medullary syndrome, and if there is thrombosis of the antispinal artery, then it is called as medial medullary syndrome. If you can appreciate, again once again you appreciate these are the anterior spinal arteries, and here is the posterior inferior cerebral artery. So if these two arteries of thrombose, then if there is thrombosis of the ventral or the antispinal artery, then it is called as anterior medullary syndrome. If there is blockage or thrombosis of the posterior inferior cerebral posterior inferior cerebral artery, then it is called as the lateral medullary syndrome. Now discussing the medial medullary syndrome, then you should know this medial medullary syndrome is formed by the thrombosis of the anterior cerebral artery or the anterior spinal artery or the ventral spinal artery. So this is the anterior spinal artery, ventral spinal artery, and this is the area supplied by this artery. So if there is thrombosis, so all the structures which are present in this region will be damaged, and depending on that there will be symptoms and sign which is called as the medial medullary syndrome. So what are the structures present and what are the damage it will cause? One is the contralateral hemiplegia, very important because there are the pyramidal fibers. So these are the motor fibers, so they cross on the opposite side. So it will be the cortical fibers which are damaged here. If there is a thrombosis of the anterior spinal artery, so it is the cortico-spinal fibers in the pyramid which are damaged, and because they cross to the opposite side after that, so this leads to contralateral hemiplegia, half-sided body paralysis on the opposite side. Okay, so this is called as the contralateral hemiplegia. Then ipsilateral paralysis of the tongue because of the hypoglossal nerve. Hypoglossal nerve will be present here deep inside. So so if there is any damage to that hypoglossal nucleus, so if you can appreciate, here is the hypoglossal nucleus. So here is the pyramid and here is the hypoglossal nucleus. So if there is damage, if there is blockage of the thrombosis of this antispinal artery, then it leads to ipsilateral, because these hypoglossal nucleus fibers, they don't cross to the opposite, they will be on the same side. So the ipsilateral same side paralysis of the tongue will be happening, because hypoglossal nucleus, as I said, will be giving fibers which will supply all the muscles of the tongue except the palatoglossus. Then there is loss of touch, sense of movement as well as sense of position because of the medial lemniscus. This is the medial lemniscus, which is the most important ascending tract, sensory tract. So if this is damaged, if there is blockage or the thrombosis of the antispinal artery, then it leads to damage of that particular side of the medial lemniscus, and this will lead to loss of sensation of touch, sense of movement as well as sense of position. Coming to the lateral medullary syndrome, so this is caused because of the blockage or the thrombosis of the posterior inferior cerebral artery. So what are the structures which are present here? One is contralateral loss of sensation of pain and temperature because of the lateral spinothalamic tract. So here is the spinothalamic tract. So if this is damaged, then it leads to contralateral loss of sensation of pain and temperature. Then ipsilateral loss of sensation of the pain and temperature over face and scalp because of the spinal nucleus of as well as the tract of the trigeminal nucleus nerve. Okay, so this is the spinal tract of the trigeminal nerve, and this is the spinal tract of the trigeminal nerve. This is the nucleus and this is the tract. So these are damaged if there is thrombosis of the posterior inferior cerebral artery. So that leads to ipsilateral loss of sensation of pain and temperature of the face, because the trigeminal nerve will be supplying the face. Then ipsilateral dysphagia and dysarthria because of the nucleus ambiguous. So you have already seen here is the nucleus ambiguous on either side. So that is also damaged because of the thrombosis of the posterior inferior cerebellar artery. Then it leads to ipsilateral on the same side dysphagia, difficulty in swallowing, as well as dysarthria, difficulty in speaking. Okay. Apart from that, you can also see the Horner's syndrome. The Horner's syndrome is a syndrome with the following symptoms. One is ptosis. Ptosis means the eyelids are down. They are not in the normal position, but they are covering half of the eyeball. So this is called as ptosis. Then there will be myopia, flushing of the face, absence of sweating of face, as well as the anophthalmos. All these symptoms will lead to a syndrome called as Horner's syndrome. So all this can be seen in lateral medullary syndrome, which is due to the thrombosis of the posterior inferior cerebellar artery. Apart from that, as I said, there are very important vital centers also present in this medulla, that is like the breathing center, respiratory center, the heart rate center, blood pressure lies in this lower part of the fourth ventricle, and hence even slight injury is fatal. Okay, it will be very damaging, and it can sometimes lead to death of the person. So even slight trauma to the medulla oblongata is very dangerous. So this is called as brainstem death. Okay, because of the damage to very important centers present in this area. Then there is also a condition called as bulbar palliasis. As I said, bulb means medulla oblongata. So this condition called as bulbar palliasis leads to paralysis of the muscle supplied by the lower fourth cranial nerve, which arises from the medulla. So the 9th, 10th, 11th and 12th cranial nerve will be beginning the medulla oblongata. So if there is any damage to these cranial nerve nuclei, then it leads to a condition called as bulbar palliasis. Then there is also a condition called a pseudo-bulbar palliasis. It is due to a supranuclear type of palliasis of the bulbar muscles as a result of the cerebral atherosclerosis. You can see a condition called as the pseudo-bulbar palliasis. Okay. So these are some of the important applied aspects related to this topic. Okay, so we have studied the medulla oblongata, its external features, then the internal features, taking sections at 3 levels. Then we have studied the some of the applied aspects related to the medulla oblongata. If you have any questions, do write to me and inshallah I will try to answer. So these are my references. Thank you very much.